And as mentioned, Dr. Tim McKnight in the house talking about antibiotics. And wow, I got this mental picture when you told me that of the good, the bad, and the ugly. Is this a spaghetti western?
I don't know. You wouldn't expect there'd be bad and ugly with antibiotics.
You wouldn't think, but maybe we don't know everything about it that we should.
I think there's a lot of misunderstanding about what antibiotics do and what they can do well and maybe harm us.
Yeah.
And I think people need to be aware of this. So the good about antibiotics, well, first of all, the word antibiotics is bio means life, and anti, of course, is against. So antibiotics are against the life of microbes. They kill microbes. Microbes can be bacteria, funguses, parasites, and viruses. And all of those types of microbes can invade our body and cause infection. So if you have an antibiotic, it will kill one of these microbes, or it can kill one of these microbes. But the most important thing I think that I want my patients to understand is I really would like to confirm I know what I'm treating before I treat it.
Yeah.
For example, somebody calls and says, hey, I've got burning when I urinate and I'm going to the bathroom frequently. I think I have a urinary infection. Would you call something in? Well, that's easy to do. But if we choose the wrong antibiotic, they're going to call in 2 or 3 days, say, I'm not any better. And then I'll say, okay, we need a urine culture so we can identify. And then I find out 5 days after they call, because it takes 48 hours to culture these, that, yeah, it was the wrong antibiotic.
Mm-hmm.
And what we're seeing with like urinary infections is some of the antibiotics we used in the past are becoming more and more resistant. And I'll talk about resistance in a minute. So somebody has a sore throat. Well, that's a tough one because you can have an abscess in your tonsil that can grow, and it can grow past the midline of your throat, the uvula, and they're very painful. And if they're growing on both sides, they can block your airway, and those have to be drained. And a phone call saying I have a sore throat doesn't tell me if they have a peritonsillar abscess, which is terribly painful and needs surgical intervention. Most of the time, it's a viral infection. So to give somebody an antibiotic with a sore throat is probably not, it's not going to help them,
Yeah.
and it will cause the bad and the ugly, which I'll talk about. So, ideally, we should get a throat culture. We should get a sputum culture when they're coughing. You might have a virus, and there's no antibiotic for that virus. And the other thing is, it wasn't until about 90 years ago that we even developed antibiotics. In the 1930s, that just in time, we had penicillin just in time for the World War to save a lot of lives. But there was still a lot of viruses and bacteria that could kill people that have been developed since then. But humans have lived a long time without antibiotics.
Mm-hmm.
And yes, some people die early, but most of us get over that. The problem with strep throat, which is a bacterial infection in the throat, is that it makes you feel miserable, and you'll get over that eventually. Your immune system will take care of that. The problem with it, and the reason we treat it, is sometimes it can infect a heart valve, and now you have a valve infection, rheumatic fever. Sometimes it can affect the kidneys, and it can cause severe kidney damage. It can put you in the hospital, and sometimes it's irreversible damage. So we treat strep throat, but we like to confirm it. Pediatricians often will not treat an ear infection, which I always struggle with that a little bit because they figure, hey, these kids might not be able to tolerate the antibiotics. They might throw them up. Do we really need to treat it? No, the immune system will take care of it. But if there are recurrent ear infections, then we're talking about potential hearing loss and other long-term problems. So we have to be careful that we don't ignore every ear infection with children. So the good news is these antibiotics often work well, specifically when we know what organism we're treating. Sometimes we'll verify that. Sometimes we'll go ahead and call in a prescription, cross our fingers, and hope that they feel better. And often they'll say, yeah, I felt better 2 or 3 days later. Well, that doesn't mean it was a bacterial infection. We got the right antibiotic. Your immune system might have kicked in and taken care of it. So people make these assumptions like nobody wants to suffer a little bit. I've got a cold right now. I'm not going to take an antibiotic for it. I'm not comfortable, but I'm taking over the counters and treating the symptoms. Okay, so the good is that they work, especially in some of these infections that we need help with. The bad is we overuse these antibiotics. And it's like anything else. If you put humans in a certain environment, let's say the Arctic, they're going to be miserable there until their body adapts and their genes adapt and they adapt to that environment. And that's what we're good at as humans. We have fewer genes than any other organism. We don't need a lot of genes because we have the ability to adapt to the environment and survive that. And the bacteria and the viruses have that same ability. So if you put them in a throat, and now you've got strep throat, and they've seen over and over again penicillin, they say, we got to survive this. How do we survive? Okay, we're going to change some things. We're going to find a way to not succumb to this antibiotic. And there's several different mechanisms. Sometimes the outer membrane of the microbe will become resistant to the antibiotic. It won't let it enter the cell. Sometimes, like a Pseudomonas infection, which can be bad in the urine or the lungs, they make these pumps inside the cell that when an antibiotic come into the cell to kill the cell, the microbe, it pumps it right back out. There's all kinds of ways these microbes can adapt to antibiotics over time to not allow them to kill them, just like our bodies do. Mm-hmm. And so this is called epigenetics. It's environmental pressure, and we eventually adapt to it. Okay, so that's the problem. We are having more and more resistant organisms now that it's getting pretty frightening to treat some of these. Methicillin-resistant Staph aureus, that's MRSA. That's becoming tougher to treat. We only have a few really good medications anymore. C. difficile colitis, that's a terrible bacterial infection of the intestinal tract, and it can be really hard to, first of all, identify on a culture or a test. Sometimes it's 3 or 4 times before we can identify it, and very hard to treat, and it kills people. And one of the reasons we have problems with it is that we overuse it. And one of the things that predisposes people to C. difficile colitis, this watery, voluminous, repetitive diarrhea all day long, is there are certain antibiotics that make you more susceptible to this, Augmentin, clindamycin, and we start using antibiotics to help your sore throat or your bronchitis. Now you have C. difficile colitis. You got a completely different monster now, and some of these drugs are extremely expensive to treat this. And those we really worry about in medicine. It's very, very contagious. You pick it up in hospitals and nursing homes. It's scary because we assume, well, our scientists are keeping up with this. We're trying, but some of these are catching up to our ability to adapt to them. So we have to be really careful. This resistance issue is scary. You should not use antibiotics repeatedly because they will get smart and you won't be left with anything to treat them. And a responsible provider is not going to just treat you because you've got a symptom and you think you've made the diagnosis, which bothers me a little bit. Sometimes it's a phone call. Either I need to come in and see you, or you need to call this in for me. Well, if you come and see me, I'm probably going to culture it and say, try to survive this. Now, if it's an elderly person with a urinary infection, an elderly woman, or a man, those infections can go bad quickly and be life-threatening. So we're careful not to wait too long to treat those. Okay, so the bad about these antibiotics is the resistance. The ugly about the antibiotics is something a lot of people don't realize. In your gut, I think we've talked about this, we have about 100,000 plus bacteria, all different types, and they're there not to infect us. They're there to protect us and to help us. And they help us digest food. They help make vitamins. They do a lot of things for us. And when we're always taking antibiotics for a cold or a sore throat that we don't need, not only are we developing resistance, but those antibiotics are killing the bacteria in our gut. And when that happens, we have this situation called leaky gut. And so if you can imagine, the lining of your intestinal tract looks like a brick wall with brick and mortar. And the food is supposed to go through these tiny pores in the brick. What happens with overuse of antibiotics is the mortar starts to break down. And when that mortar breaks down, now little particles can leak through the cracks of the wall. And when those unrecognized particles get in our body goes haywire. It says, what is this? This is bad. I don't recognize this. Oh, yeah. You get an inflammatory reaction. And that inflammatory reaction can affect joints. And it can lead to joint inflammations, like joint is an arthritis. Rheumatoid arthritis is an autoimmune inflammatory problem of the joints. Many people think that it starts with this leaky gut. This is what we call this, leaky gut. If it affects the wall of the colon, it's colitis. So it can be ulcerative colitis that infects the entire bowel. So that's an inflammatory bowel, or colitis is just the colon. It can infect the skin. We call that dermatitis. So you start getting all these funny skin rashes, and we're not sure what those are, how to treat them. That's inflammation of the skin. It can affect the muscles. That's myalgia. Myalgia is the muscles. And so you get all these inflammatory disorders because you're constantly taking antibiotics. You're killing these healthy bacteria. They can't protect the wall of the intestines, and now things leak in, and the body just freaks out when it sees these unknown, unrecognized, they're small proteins actually, and you get these inflammatory problems. So that's
ugly.
That's ugly, because what do people do with rheumatoid arthritis? Well, they're miserable, and then they'll go to a rheumatologist who will give them strong, powerful chemotherapy kind of drugs, controls their pain to a degree, but it doesn't cure or reverse the disease. It makes them feel, sometimes there's a lot of side effects with those, suppresses the immune system. That's not really the best approach for this. The best approach is get to the root cause. Just like I've said before, because I get really fired up about this, my 4-year-old granddaughter with rheumatoid arthritis, hobbling and jumping around because she hurts. She was crawling at one point because it was too painful to walk. And so she's got to go into the hospital to be put to sleep and have steroid injections in her knees periodically so she can walk without pain. And every week she's taking a shot in her leg that's a chemotherapeutic, strong, powerful drug. And nobody is saying, why does this child have an arthritis? What's the inflammatory problem here?
Yeah.
So those things, we've got to start thinking and understanding physiology and asking what's the root cause and how do we fix it. Antibiotics can save our lives when we have infections, but they can also cause other problems when they're not needed. They cause resistance, and they cause leaky gut and inflammatory bowel problems.
And the lesson is you can't just call in and assume that you know what's wrong and try to get this, and then be upset with the doctor when he or she says, no, you're going to have to come in. There's a reason for that.
Exactly. It's like, we have 4 years of training, then we have residency training, anywhere from 3 to 7 years. We've invested a lot of time and money into being able to know how to handle that. And when you call and say, I need this, that's almost a slap in the face to us, because you don't have your medical degree. I understand the discomfort, and you want to get rid of that, but sometimes that's just not going to be the way it is. Sometimes you're going to be miserable. And so we have to understand it. We have to use them correctly.
Antibiotics, the good, the bad, and the ugly, here with Dr. Tim McKnight. Thanks so much.
You're welcome.
Appreciate it.